Hi everyone, this is Katie, and this is my presentation on autism. So I found this great quote stating, "Some people with autism may never be able to speak or answer to their name, but they can still hear your words and feel your kindness." I felt like that was a great quote to kind of describe how people with autism may feel, even though they may not respond to people's words. Autism's behavioral birth, facile problems associated with uncommunicated activation to drug, also environmental exposures, pregnancy, diabetes, mellitus, that lead factors such as fetal brain development, risk for AIDS, other fetal age, extreme short are diagnosed in America. That's 37 boys and one. Boys are likely to be deaf than girls. We're still at the age of 4, though autism percent of children, 20% are borderline, have IQ scores range. On social groups tend to be diagnosed late. The first signs are shown. Progression varies greatly. Limitations, communication, or childhood. Improvements, others decline and above average until time. Others are the repetitive themselves or object order and routine. Signs and symptoms. So I'm showing this video. Hopefully you can hear it.
Boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the way I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
So I felt like that was a great video to show just some of the early signs of autism. Basically, in our textbook, it stated that there is an absent and head tilt reflex under the age of 1. You tilt the head of the infant laterally for 3 to 5 seconds. If the head does not turn upright, then that is a sign the reflex is not there. There's also abnormal head circumference, poor eye contact, and decreased shared attention, which is responding to nonverbal cues, pointing, or eye movements toward an object. They have problems with social, emotional, and communication skills. As stated earlier, repeated certain behaviors might not want change in their daily activities. They have different ways of learning, paying attention, or reacting to things. They don't notice obvious objects in the environment. Difficulty relating to others' feelings and talking about their own feelings. They don't like to be touched or only touched on their own terms, and they may be unaware when people talk to them but respond to other sounds. Risk factors include environmental, biological, genetic factors. Genetic hereditary factors are more likely to develop ASD, like if their parents or siblings have it, which is 83%, which is pretty high. It occurs more with certain genetic or chromosomal conditions such as Fragile X, tuberous sclerosis. When taken during pregnancy, prescription drugs such as valproic acid and thalidomide can increase the risk. There is some evidence that the critical period for developing ASD occurs before, during, and immediately after birth. Children born to older parents is also a risk factor, and maternal infection, low birth weight, and multiple births are also a factor. So OTs will evaluate children or adults or adolescents with autism spectrum disorder. They should start obviously with an OT profile. There are assessments that OTs use during an evaluation, which include the sensory integration praxis test, which you have to be specifically certified to perform this test. The sensory profile, there's a caregiver questionnaire, a school companion, or an adolescent adult profile. The sensory processing measure, sensory experience questionnaire, the developmental test of visual motor integration, and the COPM. Areas of occupation. So pretty much all areas of their life are affected, including work. It's hard for people who have autism to select a work that they particularly like and then also perform that work. Education is affected, including participation in academic, non-academic, extracurricular, and vocational activities. Leisure exploration and participation skills, social participation within their community, family, peers and friends, hypersensitivity, and sensory seeking were significantly negatively associated with social adaptive skills. Play and play exploration and participation are affected. ADLs such as bathing, showering, toilet hygiene, dressing, feeding, functional mobility, personal hygiene, and grooming. IEDLs such as communication management, health management, and maintenance, meal prep and cleanup, safety and emergency maintenance, and shopping, and rest and sleep. So the models that I chose for using with anyone who has autism spectrum disorder include the ecology of human performance, the person, environment, occupation, emphasizes the importance of considering context, particularly authentic context, when addressing participation, and context may also be highly variable. The MOHO is an evidence-based conceptual practice model that explains how people adapt to severe disability and live a meaningful life. Occupations are motivated, patterned, and performed, and offers a broad and integrated view of human occupation. This includes the child's participation level and identifies the barriers from birth to the age of 21 years old. It includes client-centered and occupation-focused principles of the human occupation theory and further demonstrates the patient's pattern of strengths and weaknesses in occupational performance and can be used to design appropriate intervention programs. The frames of references that I selected. First, I selected the sensory integration frame, which finds activities that involve the type and intensity of sensation the client needs to normalize their sensory processing and productive adaptive responses. The inner drive of the client will continue to spiral upward toward increasing maturity. They desire to engage in functional activities will increase. The lifespan development frame, which addresses an individual during a transitional period and throughout their lifespan. It assists with adaptation to changing roles such as identity issues in adolescence or retirement later in life, establishing and restoring client-chosen, age-appropriate occupations within continued life roles, and helping clients to adapt to the changes brought on by health conditions within and across their lifespan developmental continuum. Applied behavioral frame, OTs, will help to facilitate desired behaviors by defining goals and working toward them using skilled instruction, modeling, coaching, and behavioral reinforcement. In the cognitive behavioral approach, which is when psychological barriers to activity engagement are encountered, it's used in behavioral medicine because it is especially effective in dealing with motivation and emotion. In OT, cognition and emotion is the focus of the evaluation and intervention. So OT interventions include sensory integration, which is finding a just right challenge in auditory, tactile, visual, gustatory, vestibular, oral, and proprioceptive activities. Neuroscientists define SI as the brain's ability to organize sensory information received from the body and environment to produce adaptive responses. So a lot of people who have autism also have sensory integration issues, and I find that sensory integration is a great intervention to use with these students. Also, exercise such as yoga, brain gym, and obstacle courses are used to help increase their attention, their focus, organizing their bodies. If you're unaware of what brain gym is, it's a variety of movements that you will ask the child to do, such as positioning their hand right underneath their collarbone, one hand on their collarbone, one hand on their belly button, and you hold that position, and then you switch hands. That is an example of brain buttons, which is a brain gym move. Brain gym has been found to increase participation, and it helps to get the brain communicating together. That's kind of the theory behind brain gym. You want to ensure their safety in their home, school, and work environment. You want to use activities and arrange the environment to help the child to maintain self-regulation and alertness. You want to challenge their postural, ocular, oral, or bilateral motor coordination in a controlled environment. You can collaborate with the client on their activity choices. You can work on feeding therapy, so this would be desensitizing or tolerating food textures, dressing and hygiene activities, social skills training, which includes play skills for children and increasing their leisure skills. And these are my references. Thank you for listening, everybody.